You do need to pay for this. I'm so sorry. Your algorithm said that they don't. So then it was investigated even further, and this has been happening, I guess, for the last 4 damn years. Okay, and it goes to show that I think that what Dr. Eddy wanted to look into, and what he was trying to say to when he sent it in, it's very relevant. Is this is sort of the future of insurers, where they're not going to entrust medical, doctors. They're going to entrust AI to just be like, oh, we'll give you the money. Maybe we won't give you the money, depending on, how we feel or where we come up with. Now they're passing laws to make sure that this can't happen any further. I don't know what kind of safeguard that's really going to have, because
It
AI is going
affects
to be in everything.
Medicare, but outside of Medicare, I don't think there's been anything as of yet.
No, and the thing is that they're already saying, if you have been with United Healthcare for the last 4 years, you're in a position to make a claim against them if you had to use their bullshit algorithm to get money to pay for legitimate medical concerns that
Side
you
note on
have.
that.
Yeah.
Well, also you don't know if you have United or actually any other healthcare provider in the future, potentially, you don't know if you are relying on the algorithm or not, because they do not tell you how
Right.
that decision was made, who made that decision. And so therefore, if it was made algorithmically, or as AI gets more advanced by an actual AI or what have you, that's something that's going to be as blurry and muddled and hard to figure out as possible, because transparency is the enemy of this entire process, and always has been when it comes to medical insurance
Well,
and the
it's
medical system in general in the United States.
no, it's the medical system is absolutely. And here's just one more example. It's just one more example of how up it is that here they're not relying on doctors to make this independent assessment. They're just using some algorithm that sides with them not to give you the money that you are supposed to get. Okay, so it's really, it's so messed up on so many levels, and it's one of those things where I think that we're not even close to scratching the surface of where this is all going to go, where this artificial intelligence and algorithms are going to control the monies involved in saving our sorry asses in the future going forward. Because honestly, I'm really, really terrified that the older people get, the more they're going to have to rely on Hal. And Hal is just going to be like, you've lived long enough. You don't get the money. Goodbye. It showcases how horrible in the divided states of failed economy it is with insurance. In the fight of his life here, okay, with the stem cell treatment, and battling a rare form of leukemia. And he's only started this fight, and probably in what was it, Dave? February, March of this year, something like that. And it
Thereabouts.
hasn't even been a full year yet. Okay. He's been hospitalized 4 times in this, and then outside of that, he's had treatments that are outside of the hospital
Outpatient,
realm as
yeah.
well. Yeah, outpatient stuff as well. Okay. He took a picture of just one of his hospital bills that they sent him. Just one. Okay. And he, like I said, he's been hospitalized. He's 4 stints now. So times four. Okay. This bill, it was like science fiction. It would the number that he owed for one hospital stay was so far beyond the realm of possibility for a human being to pay it. It's, Dave, I don't even know what to say. It was, it went beyond shocking to and disbelief to just dumbfounded. Dumbfounded. Like you would
Plus,
have to be like a mul
the
like
owner of Amazon.
you would have to be a multi-millionaire, kind of like a big time celebrity or something, to even think about paying what Edward's being charged to have his life saved for his
And Edward
family.
has insurance.
Mhm. And he told me that the insurance, because I said, listen, both as your friend, as your brother, as someone that loves you, And just out of sheer curiosity as a human being living in this country, how do you pay this? Like, what do you do, Edward? Because the GoFundMe sure as shit ain't going to take care of this. So I said, where do you even begin here? You know, I took it off the group text chain and we brought it one-on-one. And he was just like, Jason, it's just, you know, it is what it is. I think that when you almost die and you're, you know, you're still alive, I think that the bills are kind of funny. I mean, they're not funny, but it's just like, you know, I cheated death. Now I have to somehow figure this shit out. And
also, you only have the emotional capacity to deal with one
right,
crisis at a time. And, you know, the more important one is health.
But when the money is so hysterically science fiction high, it's just it showcases that a man like Edward, whose whole life is based on saving people's lives, is now given this bills, and you're like, this is so. And you know, he said that the first time around, his insurance company, obviously he maxed out on the deductible like right away. Okay, but then I guess when they found out, you know, when it was renewed halfway through the year, now he's got, you know, he's got leukemia, yo.
Yeah.
So there's a little bit of a different plan now with the insurance company. You know what I mean?
Mm-hmm.
Bullshit. Just absolute bullshit. So the thing is, I don't even know where to begin other than there's no way to live in this country and whatever you do to have a comfortable existence, both while you're growing old and then when you old, when you're in the land of ancient, okay, because we're all living longer, whatever you've done to save and cushion, that's gone in one hospital stay, one medical issue, which we're all going to have. Okay, that's the Cracker Jack prize at the end of the life box. Okay, disease, cancer, heart attack, some shit. That's your prize. You're going to go through everything that you have anyway. What the our medical system is so it doesn't take care of its people. The social contract that our government and our society has with its people is null and void. This society does not take care of its people. It does not take care of the rank and file. All we are is cattle. That's all we are is cattle. And seeing shit like what happened with Edward, and then to see what he's being charged with the kind of money that he's expected to come up with, it's a joke. Dave, it's a joke. And then you see these articles that he's sending me to highlight even further that in this, you know, the greatest country on God's green earth, that this is what's expected of us. This is the kind of medical care we're getting, the kind of money we have to pay for that. And they're wondering why all of us in this country have just been like, you. Like, it's enough of this shit. You're not taking care of us. Why the should we take care of you or even care about this country? You don't care about us.
Well, what struck me earlier is when you said that the algorithm or the program that was being used had a 90% error rate.
Mm-hmm.
Now, you know, specifics and you know, that how that figure is calculated absolutely matters. Specifics matter, and I'm curious how that number was calculated. But because the article, at least that you sent me, didn't really go into the details on that as far as how that number was come up with. But even if we let's take that at face value for the sake of argument for the moment. If you're a company whose entire business model is to have more people paying into your company than you are having to pay out in benefits, and you create a program that, say, 90% of the time is predicting, no, you don't need to, company, you don't need to pay this. They should be able to take care of that. That is not an error. That is a feature. That is not a flaw.
No.
And also, we've talked a lot about algorithms and AI and all that kind of stuff in the past, even like within the last episode.
Mhm.
But this actual issue is not even a new thing, even when you take the computer out of it. So insurance companies have always been looking for ways to justify refusing treatment coverage.
Mhm.
An algorithm just gives them a new reason to do it, and this time they don't even have to pay necessarily nurse practitioners to summarize the records to begin with. So this is the more recent version of what has been a longstanding feature in the healthcare system.